If you've been dealing with chronic headaches, neck pain, vertigo, or fatigue, and you feel like you've tried everything, I want to ask you one question before you give up. Have you ever had your atlas bone alignment evaluated? Not your neck in general, not a general chiropractic adjustment, specifically the top bone of your spine called the atlas bone, using precise imaging and measuring it in 3 dimensions. Most people haven't. And for a lot of patients we see here at Koru Chiropractic in Louisville, Colorado, that one bone is the piece that's been missing from the whole puzzle. Today I'm going to explain what NUCCA Chiropractic actually is, how it's different from what most people think when they hear the word chiropractor or chiropractic, and how to know whether it's relevant in what you've been dealing with. My name is Dr. Norris. Let's get into it. NUCCA stands for the National Upper Cervical Chiropractic Association. It's a specialized technique, not just a philosophy, but a specific, standardized method that requires postdoctoral training beyond chiropractic school. It was developed in the 1960s by a chiropractor named Dr. Ralph Gregory, who became obsessed with the one question: what if you could correct the spine by addressing one specific point at the very top rather than adjusting vertebrae up and down the entire back? What he found, and what decades of clinical practice have confirmed, is that the atlas bone at the top vertebra of your spine has an outsized influence on your health of the entire spinal and nervous system. When the atlas is misaligned, the rest of the spine compensates. Shoulders drop, hips shift, the whole structure adapts to protect the brainstem. And that compensation pattern is often where the chronic symptoms begin. Fix the atlas alignment, the compensations unwind, and the spine can actually hold itself upright in the way it's designed to. That's the core idea behind NUCCA. Let me give you a quick anatomy picture because it really does help make this make sense. The atlas bone, C1, the first cervical vertebra, is a small ring-shaped bone that sits at the base of your skull and is named after the Greek Titan who held up the world, which is fitting because this tiny little bone holds about 10 to 12 pounds of weight from your skull, your brain, and your face. Yet the bone is about the size of a small little ring here. Now, here's what makes the atlas unusual. Unlike every other vertebra in your spine, C1 doesn't have a disc above or below it. It has no interlocking joints to stabilize it the way the rest of your vertebrae do, and it relies most entirely on muscles and ligaments for stability, which makes it the most mobile joint in your spine, but also the most vulnerable to injury and misalignment. And it sits roughly right around your brainstem. The brainstem is the control center for your autonomic nervous system, the part of your nervous system that regulates your heart rate, your blood pressure, sleep, digestion, and your fight or flight response. It also routes virtually all communication between your brain and your body. So when the atlas is even slightly out of position, and we're talking millimeters here, it can create tension on the brainstem and the spinal cord, alter blood flow, affect cerebrospinal circulation, and disrupt postural balance in ways that ripple down all the way to your feet. This is why NUCCA patients don't just come in for neck pain. They come in for migraines that medication can't touch, for vertigo that's been going on for years, for fatigue that no one can explain, for high blood pressure that came out of nowhere and no lab tests can explain why. The atlas is small, its impact is not. Now let me address the thing I hear most often. I've tried chiropractic and it didn't work. I get it. And I want to be honest with you. That experience is real and it's valid. But I also want to offer a different frame. Saying I tried chiropractic and writing off NUCCA is a little bit like saying I tried medication after taking an acid for heart condition. The category is so broad that the experience may have little to do with what we actually do. Here's what's different. First, we image before we touch you. Before any correction happens at Koru, we take precise imaging of your upper cervical alignment. which includes CBCT or cone beam CT, similar to like when you go to the dentist and they do those 3D scans of your jaw. We measure the exact angle of the misalignment, the direction, the degree. Every correction is calculated specifically for your anatomy and your unique misalignment. Most general chiropractors or traditional chiropractors do not do this for the atlas bone specifically. They may take x-rays of the cervical spine in general, but it's not the kind of precision imaging that tells us exactly what correction is needed and in which direction. We measure, we don't guess. And that's not just a tagline. It's the clinical standard that we hold ourselves here at Koru Chiropractic. Second, the adjustment is nothing like you've experienced before. There's no cracking, there's no twisting, no high velocity force. The NUCCA correction is gentle and a sustained contact just below the ear here where the atlas is most accessible. The force is so light that the first time patients often ask, was that it? Yes, that was it. And it works because of the precision, not the force. Third, the goal is correction, not management. We are not in the business of getting you to come in 3 times a week for the rest of your life. Our goal is to achieve a stable atlas or upper cervical correction, meaning you hold your adjustment and then reduce the frequency of the visits that as you stabilize. We track progress with objective measurements every step of the way. You'll see your own data, you'll know whether you're holding or not, and that's how we work. If you're curious whether NUCCA might be relevant to your situation, here's exactly what the first visit looks like. You'll start with a detailed health history with one of our doctors. I want to understand not just your symptoms, but your timeline, the things that cause this to get started, and whether, or better or worse, what you've already tried. Do a postural and neurological screening. We call this neurostructural testing, looking at how your body is compensating for what may be an atlas issue. Then, once we've identified that, we use advanced imaging, the CBCT 3D imaging I mentioned below. It's a low radiation 3-dimensional scan that shows us the atlas in a way that standard x-rays simply cannot. Then we'll review the findings together. You'll see your scans. I'll explain exactly what we found and what it means and whether I think an upper cervical correction makes sense for you and your care. And if it doesn't, I'll tell you that too. No pressure, no surprise fees, no commitment required to book the consultation. If anything in this video resonated, if you've been dealing with symptoms that haven't responded to treatment and have never had your atlas or C1 vertebrae properly evaluated, I'd encourage you to take the next step. Call our office here in Louisville or fill out the consultation request form at koruchiropractic.com and we'll get you scheduled for a new patient exam, and you'll walk out knowing whether this is something worth pursuing or something that we need to find another solution for. And if you want to go deeper on any of these specific conditions I mentioned, migraines, vertigo, tech neck, post-concussion syndrome, I've got videos on all of that, so just subscribe below so you don't miss them. I'm Dr. Norris. Thanks for watching.